see her on the video.
But
She seems to have kept it closed.
so this is Rohit, myself. Hey, Arvind.
Natarajan.
Natarajan.
This is
Arvind. Arvind.
students.
कौन है?
Some students.
अच्छा, कंचन.
In another minute, we will start the events.
Okay. Recording in progress.
हाँ?
Recording in progress.
So shall I start?
Yes.
Okay. So the Dr.M.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean of CGS Medical College and KM Hospital, welcomes you to this session of reminiscence. I ask the tech team to play a video of Division of Medical Humanities.
Playing a video.
આ નજીક લઉં થોડું આરામથી બેસો. Hello, Rohit.
Yes.
How are you?
Fine, Suresh. Nice to see you, Suresh.
Yeah, good, good. I think it's a good gesture you have done.
Where is Mugat was also to join? Mugat has not joined yet.
Hi, Bapat.
Where is Mugat?
Yes, Mugat is not coming, ne?
Bharti and Veerbada also was to join.
I think Praful is also not coming.
No, not coming, Ajay.
Okay. So CGS Medical College and KM Hospital will be celebrating its centenary soon. As we prepare for the centenary celebrations, we have a message from our Dean, Dr. Sangeeta Rawat, in the form of a PowerPoint presentation. I request the tech team to please play the PPT.
તમારું નામ ખોટું લખ્યું છે.
It is the students' past and present that makes our college what it is. So, as our Twin Institute moves towards the centenary, we want to give a virtual platform to every batch of GSMC to share their fondest memories of their college. Their thoughts and emotions will be preserved forever in the form of these reminiscences. I request the tech team to present the GA membership form, please.
To remain connected to our alma mater and informed about the activities in KM, including its centenary celebration, we request you to become the members of Gosumec Alumni Association, the official alumni body at SAIT GSMC. All the details on how to become a member and this membership form are available on the KM website. All those who are not members as yet are requested to please visit the KM website. Now, I would like the coordinator from the batch to take over the proceedings.
Hello, Dr. Sejal. Hello.
Yes, sir.
You and South can ask questions to about the 7 to 8 batchmates
Okay,
are
sir.
there. Okay, so either you or South can start with the questions, and anyone can pick up and answer. Okay.
Yes, sir. Yes, sir.
Hello.
Noted.
Yeah, either of you can comment.
So, yes, yes. I could start. I wanted to ask the members of this batch that what made you choose this profession of medicine?
Each one might have a different reason. For
Hello.
me, yes, all may not have the same reason to join a medical college. But for me, I can say why I joined medical college. I lost my brother's wife during childbirth. And then I thought that if I was a doctor, I would have helped. So that's why I joined medical college. Maybe others might have different reason for taking the medical course. Bapat, what is your reason? Why you join medical college?
Why did you join medical college?
Well, I always wanted to become a doctor right from my childhood. And I pursued this particular intention by joining the inter-science at Gujarat College, Ahmedabad, and passed the inter-science from Gujarat College. And then I was first at the inter-science examination and received a coveted Gibbs Prize in physics, which was a big surprise for me. Anyway, I decided to join a medical college, and with that intention, visited JJ Hospital, which somehow didn't impress me. And then my next intention was to visit the KEM Hospital. And here I was much impressed by the overall atmosphere, the entrance, the college building, and of course, since I knew I would have to stay in the hostel, I visited the hostel and was very happy to see the hostel building and the facilities that were available at the hostel itself. So all this made me more or less decide that I would join the GS Medical College and pursue my desire to become a doctor here.
Vimal, what is your opinion? Why did you join medical college?
Yeah.
Because that was the best option in my generation. That's why I always wanted to go for medicine. There was no other doctor in my family, so I wanted to be the first one to do so.
Oh, great.
Mhm.
Why
And
did you join medical college? Arvind, why did you join medical college? You are mute. You unmute yourself. Suresh, can you tell us why you joined medical college?
My father was in my business, and nobody in the family was beyond a matric. And
Oh,
I had seen then desire to be a doctor. That made me very close
very
to
good.
him. Here, I think you're correct. Please correct. It is not Sanjay Parikh. It is Suresh Parikh. Okay.
Yes, Sejal, any more questions? People
So,
have said
sir,
why they joined medical college.
as respected Dr. Bapat said that he visited St. GS Medical College and he was happy with the campus and the hostel there. So I have like a similar question to the rest of you. Why did you choose St. GS Medical College in specific? Like instead of all the other medical colleges, is there any specific reason?
Yes, for me, I was told that it is one of the best medical colleges as compared to that time only 3 medical colleges were in Bombay. Nair Medical College, Grand
Yes.
Medical College, and GS Medical College.
Okay.
GS Medical College had a good reputation. So we were in Gujarat, and so in GS Medical College, 80 seats are there every year, out of which 60 seats are reserved for local people from Bombay. Only 20 seats were for outsiders. So we had to compete for 20 seats from all one. That was Maharashtra, Gujarat, Kutch, Karnataka. All these were included in 20 seats. And we were lucky. We were 8 from Gujarat. Sharad Bapat, myself, Dr. Mohile, Meena Marfatia, Kunda Mohile. We were 8. And Munsif was there, Navy of Dr. K.G. Munsif, who was a surgeon. So I think it was more the reputation of the college and the hospital that made us join GS Medical College.
The reputation. Nice.
Yes.
You can go to the next question, so.
Yes, yes.
I
So
wanted to ask, what was the like everyone has their memories of the admission
Your voice is not audible.
process go.
Sejal, your voice is breaking, so let Saud ask the question.
okay, so like I wanted to ask all of you about your first day of college. Do you have any like first impression or like any memories from the admission day? It was very
Sharad, you want to say something? Well, I will say I come from Ahmedabad, and it was my first visit to Bombay. and the atmosphere. I was separating from my family for the first time, so I was feeling more homesick. We went to the hostel because we are all accommodated in the hostel, which has very nice rooms. Since Sharad Bapat and myself scored better, we got a pregnant room, double pregnant, we call it. You know, those who are staying in the hostel know there are three types of rooms. Double pregnant room is a corner room. Middle pregnant is only one projection. And latrine pregnant, near the latrine there was another room. So Sharad Bapat and myself were lucky to get a double pregnant room. So we were very happy. But my brothers were coming from America after 2 years of education there, and they were in Ahmedabad. So I was feeling very homesick. So we had a dissection part was given to us a hand for dissection. So I wanted to go to Ahmedabad for a week to meet my brothers. So I told Sharad Bapat that you remain here and we will not be able to dissect for 1 week till I come back. So Bapat used to go every morning, cover the part with formalin, wait for some time, and go home and waiting eagerly for me. But after a week, when I come back from Ahmedabad, we started our dissection very well. And after every part dissection, we have to appear for examination. So I was afraid that I will not be able to pass because if you don't pass, you have to repeat the part. But fortunately for us, Dr. Kopikar was very good for us, and he passed us, and we got a second part, which was called the shoulder. Then that is how we started. So Suresh, do you have any comments?
No, nothing.
Sharad, you comment something.
No, I think you have told already about the dissection hall and MLT. Is that correct?
Yes.
I don't have anything additional to say about it.
I want to say
Except
two
that I
things.
was,
We joined in 1950. That was incidentally was the silver jubilee of the medical college. So our batch is called a silver jubilee batch. So the whole year was busy celebrating, making preparations for the silver jubilee of the medical college. And we were, at our time, we never heard what is ragging. Now what you see very often, this was a word which was not known to us, what is ragging. We were good enough. We actually felicitated the second batch that joined us in 1951. And we had a good celebration. They were very happy. We have welcomed them. And we had a garland for them and tea party after the end of the session. So ours was the first batch which felicitated their juniors when they came. But we were preparing for the procession, Silver Jubilee. Our Dean Raigore was saying that we must have an exhibition, move around the whole city of Bombay collecting donation. So we had different bogies. Dhan Rath is called Dhanvantari, and all different gods of were there. We moved around to collect the donation, and almost from 10 to 6, we moved around all the city of Bombay and collected a fair amount of money.
तुम्ही जाऊन डोनेशन घेतले होते ना ते सांगतो.
Okay. That's interesting. So, like, recently, our CGS Medical College, like near the gate one of our college, near the main entrance, we had a new fountain this year, which was incredibly beautiful, and the photos were shared on the group. So, I wanted to ask all of you, like as these changes have occurred recently, could you tell us about the layout of the college at your time? Because I'm sure it must have changed differently. And also, any views on the new fountain that you have seen? Or any new changes that have like astonished you?
I prefer to listen.
Vimal, you want to say something?
No,
Your
what
comments?
number is workers bus that was right at the entrance of the. That's the only first thing I remember about college.
sorry, I can't hear properly.
Loudly. And the first thing I remember is Dr. Shirwarkar's statue or bus that was at the entrance of the college.
Yes, that's still there, man.
Yeah. That's one thing, and the anatomy dissection hall. That is the second thing I remember. And still I don't forget, still I have not forgotten it.
Suresh, do you want to
I
comment?
don't,
How was your first impression when you joined?
I don't remember at all.
As we enter, to the right side was a undergraduate library. To the left was a postgraduate library. And the dean's office was at the extreme right. Then there was a canteen as we go to the left. And there was a nice canteen. We often used to visit that canteen. But I feel that the front of the medical college, except for the fountain, rest of the things have not changed according to me, whatever I see. But the fountain was not there. But there was a very good garden in front of the college. But
Yes.
there was no fountain that time.
Yeah, it was just recently made, the fountain, like this year only, I guess.
That's right.
Earlier this year, yes. So, like, do you have any feelings about these new changes? Like, for example, the fountain or anything. Do you feel good about it?
Oh, yes. I think next year when the centenary celebrations come up, we would like to come and see our rooms, hostel rooms, our college, the fountain, and meet so many of us. I don't know how many will be leaving next year out of 80 batch we are joined. We are already 10 or 15 left. But I think we would like to come to Bombay when we are celebrating the centenary.
We'll be honored to have you, sir. So, Sejal, you can take over.
Yeah, I wanted to ask which of the memorable faculty members taught in each of the departments during your time?
We have in the first MBBS anatomy, physiology, and biochemistry. In physiology, there was a hematology laboratory, and there was
Okay.
one attendant who used to help us in making the slides and everything. But his English was not very so good. So sometimes he used to give funny jokes. One of the lady was saying that she has not given the blood. Then he said in English, "Madam, you want to lie with me? You want to lie with me?" Actually, what he would say, they are not telling correct truth. But he was speaking a broken English. "Madam, you want to lie with me?" And everybody laughed. And in anatomy hall, that is very important. We had Dr. P.M. Mehta. He was a very senior general practitioner and very, very known person. He used to remember everything by size. Structures which are 10 inches long, structures which are 18 inches long, and then we used to memorize. And then we had Dr. Pereira, who used to have good mnemonics, and he used to rattle out 10 structures passing out from foramen magnum, and we were all aghast by his knowledge. He used to rapidly say everything. Which are the 10 structures which pass through the foramen magnum? What is the length of the duodenum? What is the length of the femur? All these things we had to learn by heart. And that was very interesting. Kopikar was very good to us. He used to show how the peritoneal cavity is there. He used to say it is like a rajai, and then how all organs are embedded inside. So when we came to dissection hall, Dr. Kopikar was very useful to us, and we learned a lot from Dr. Kopikar. Unfortunately, he finished his tenure when we were finishing the first year. He went to Jaipur, and Dr. Kurulkar take over. In physiology, we had Dr. Montero. We could not understand because he was speaking in a little funny tone, but very good teacher. Patliawala, Pasig gentleman, he was a professor of physiology, and he was a good teacher. Then in pharmacology, Dr. Roger Lewis came from England and as a WHO fellow for 1 year as a teacher, and that was very good. We could learn a lot from Lewis. He was expert in experimental pharmacology, and he established a very good laboratory. In pathology, we had Dr. Purandare, N.M. Purandare, and Dr. Banker. And when that was the time when this WHO team came, John Fleming, famous man who discovered penicillin. Dr. Aub was a medicine. Dr. Halstead was a surgeon. So we used to have a nice time. They visited us for 3 weeks. They stayed in Bombay. They went to Pune, and we had clinical pathological conferences. Then Dr. Fleming, there are some photographs which I think Dr. Natarajan may show. Then Dr. Fleming came and he went to pathology department to explain to them how to make the culture and everything. So that was a wonderful time. 3 weeks, the WHO team for the first time we were facing, and we all were very pleased to see all the foreigners coming to the college and giving the lectures, demonstrating the surgical skill. Dr. P. Sen was a surgeon, and Dr. Halsted demonstrated his thoracic surgery to him. We used to go to the main lecture theater. There is a gallery in the MLT. So we used to wait in the MLT to watch the surgery done by these visiting surgeons. That was a wonderful experience to us.
Wow, so that was very great to know.
Sejal, say just a second.
Huh?
Am I audible?
You forgot.
Yes.
Dr.
Yeah. So,
Yeah.
Dr. Bhatt was referring to some slides. So, if Tushar can project those slides one at a time, the photographs, so that the sir can identify with the talk just now, whatever you said.
Can you just, Dr. Hirve wants to also say something?
And you.
Yeah. So, after Dr. Hirve.
Dr. Vaya.
Secretary. Vaya was secretary.
Lectures were always very interesting. Dr. Vaya from psychology.
Yes, he used to give very good lectures. We all enjoyed his talk.
The doctor was very good. And this, of course, our lectures were lectures. But Dr. Kopikar and Dr. Vaya, and then Dr. For our hygiene, we had one doctor, I forgot his name. He used to give last year of the, he used to give very
Dr. Gandhi, MP Gandhi.
Dr. Gandhi, that he was very good. That's it.
Dr. Jadhav was our jurisprudence teacher. He was a vice dean as well as a professor of jurisprudence.
Tushar, we can project those photographs which Dr. Bhatt had
Yes,
sent.
sure. I will show one by one, sir. Yeah.
Yeah, and Dr. Bhatt can talk about them.
Yes, I will give the comments. We were 80 students when we joined. So this is when we celebrated in 25 years after our joined. That is 50 years since the medical college started. And we had, these are all these, I think maximum coverage was there at that time, 2000. We met in Bombay. So many of those who were outside Bombay, they came specially for this. I don't know whether you can recognize any of them. It's a little faint, but these were this. I think they came with the family, the spouses, and we had a wonderful time together for 3 days. We met in MLT. We invited the teachers. Dr. Bharucha came, Dr. Dholakia came, Dr. V.N. Purandare came. So, and they gave a talk and mixed with us. Dr. Dholakia was there. Dr. E.P. Bharucha and Mrs. Bharucha, she was a pediatrician. They all came to MLT and sat with us for time. And we had a wonderful time for 3 days in 2000. And this was the picture taken by that time because, and Dr. Vaya was there at that time. If you can we show the next picture? This is Dr. Bharucha. This
is Jawar.
To the left of Dr. Bharucha is Dr. Garveer, Mrs. Satashkar. Behind Dr. Bharucha is Dr. Mansukh Gandhi. Then extreme left, there is Suresh Parikh.
That's right. This is Vinu Desai.
This is Vinu Desai, yes.
This is
one to the left of Dr. Bharucha is Mansari Manyar.
Manyar. This is, I think,
Mansari Manyar. She was a pediatrician. Extreme right is J.T. Shah. And next to him is Dr. Haren Shah. Mansukh Gandhi is just behind Dr. Bharucha. Can you show the next slide? Yeah, this is myself, then Sharad Bapat, Mansukh Gandhi, Dilip Kaur Munsif, Veerbala Desai, and behind that is Markand Bhatt. Markand Bhatt is a surgeon. Veerbala is a gynecologist. She lives in Calcutta now. Dilip Munsif was a general practitioner.
What
Next
is
one,
his
can you show?
name?
Is Dr. V.L.Kothari came with Dr. Anas Vaya. There is a repeat, I think we have shown this. This has come again. Can you show another slide? Next slide, can you show, please? Yes.
Hello, Rohit.
Yes,
These were the photographs from the book that we brought out, correct?
that's right. That's right.
Yes. Because at the Silver Jubilee, our get together in the year 2000,
Yes, that's right.
we had got all this printed in a booklet, a small booklet, Gosumec 5055, which we gave to almost everyone who joined us at that particular time. And I hope you have this particular book, small booklet, in which we at least at that time tried to get as many details of every person from our batch, details about him, his spouse, and whatever other information that we were able to get. So all this information was available in this book that we produced at the time of our first get together.
That's right. Can you have the next photograph?
Yes.
This,
Can you identify people in this
can you see
photograph?
Dr. Parulkar, Dr. G.B. Parulkar, Dean of the Medical College? He was our classmate with a suit. Dr.
This is Mugat.
Parulkar is with a suit. This is Dr. Extreme left is Dr. Mugat Shah. Then there is Dr. Bapat, Dr. Munsif, myself, Vijay Mehta, Mansukh Gandhi, Suresh Parikh. These are some of the members of our batch, 1950. Can we have next one? Oh, this is Dr. Barucha, Dr. Sherity, Dean, Purandare, Dr. Dholakia, all came to the main lecture hall, MLT. We had a 2-hour session. All of us gave our opinion. Dr. Bharucha addressed us, Dr. Dholakia addressed us. It was a wonderful time. Extreme left, you see Sharad Bapat conducting the program. Can you show the next one? This is extreme left is Sharad Bapat. Middle is our batch. You know, our batch was very small. We were only 8 in a clinical term. We were only 8 or 10 people, and so that's why it was very, very personalized attention given to us during our clinical placement.
प्रोजेक्ट करतात
माझा इतका काय दाखवते
हे तिन्ही बद्दल ते बोलले रोहित भट तिन्ही बद्दल बोलले आता नाव दे हॅव टू चेंज इट दे आर स्टिल नॉट डन
Extreme right, you can see Dr. B.N. Purandare, Dr. Paranshipe, Dr. Ms. Daruwala. We did a clinical term under her. So at the end of the term, we used to take a photograph, and our teachers are very good. They used to take us for picnic. Dr. Baliga, we did a surgical term under him. He took us to Khandwa, and then Lonavala, there was a wonderful parasol house of one of his patients. And we spent one day with them entire. He arranged for 2-3 cars for us to take us to Khandala and Lonavala. Dr. Munsif was taken to Powai Lake. That photograph also will come. It was wonderful. Dr. P.K. Sen came, Dr. Adia came, Dr. Arthur Disa came. So we had a wonderful time because our batch was very small, 8 or 10. Now, when I hear that you are having 250 admissions, I wonder how personalized attention would be given. Here, our teacher used to know us by name. Now, if batch of 20, 30 people, it is difficult for the teachers to know each one individually. But now times have changed. 300 admissions, 250 admissions now. At our time was only 80. Next one. So this is at Khandala. What you see is Dr. Bhatia, Dr. Hegele, and Dr. Bapat arranging the dishes. We had taken the food with us. So the extreme right is Dr. K.G. Munsif. He took us to Powai Lake, the entire batch, and his wife had prepared a wonderful tea of snacks. So we all enjoyed. There is M.R. Chaudhary was the registrar at that time. Now he is settled in Akola. I think you must have heard. He gave a wonderful talk. M.R. Chaudhary. He was a registrar when we were the students. So we went to Powai with Dr. K.G. Munsif. So there's so much personalization, attention was there. They loved us and we loved our teachers. Next one. See our teacher. Left is V.N. Purandare. Then middle is Dr. Arthur Disa. Right is Dr. A.B. Baliga. Low down, right is Dr. Falke and his wife. And left bottom is Nimkar. She was physiotherapist. She brought the physiotherapy department along with the dean, Dr. Dhaigude. Next one. Say this is Dr. Fleming, Alexander Fleming. So you see he was demonstrating Dr. Bankar, Dr. Anam Purandare, Dr. Fatke and Dr. Sheth. Right bottom you see Dr. Dhaigude when he died. We had a procession right from our medical college, his dean's house, to the crematorium in Shivaji Park. So all procession, all the medical students and doctors joined. And this is one of the pictures that I had taken in 1951. Middle one, you see Dr. Baliga and Dr. Adatya. He was a good surgeon and he wrote a lot of books. His daughter was RH negative. And that's why he had done a lot of study on RH negative at the time. There was a lot of literature about the RH negative and RH positive. So he did a lot of work on RH and published a lot of articles. And left bottom is Dr. Darwala, under whom we had our clinical term. I think that's all. No? Are there any more pictures? I think that's all.
Yes, sir.
You know, that time there were no color photography. These are all black and white in 1950, 55. There was no color photography. So these are all what I got from my album. So I thought it might be good to preserve. I have preserved it for nearly now 70 years. Pictures taken in 1950, 55 are preserved till 2024 in my album.
It's a rare collection. Wonderful. And Sejal, you can continue with the questions.
Yes, sir. So my next question would be
Yes, sir.
yeah. So we are just second MBBS student. We were just introduced with our first year anatomy sessions and all last year. So I wanted to ask all of you about your dissection hall sections because that holds a true memory for me.
Sharad, you say about the dissection hall?
Yeah. I remember dissection hall, but I think it was not a very pleasant occasion to have dead bodies on which we all were doing our parts, dissection of various parts, but we were in small batches, and each one of us, where a group was given a particular part to be dissected. I think that is all that I remember about the dissection hall.
Rohit,
Sir, I would be.
how many are still existing?
How many?
Out of 80, we are able to contact about 14 or 15 people. 46 have died. We got information about that 46 are no more. But there are some others we do not know because some of them went to America, some went to Africa, and we have lost touch with them. We had 3 members coming from outside, nominated by the government of India. There was one Ishwar Rajput. He came from Durban, South Africa, government nominee. Then there was one Jagat Prasad. He came from Guyana, British Guyana. And he was very tall and he was staying in the hostel, same wing as we were staying. He was a very commanding man, but not so good in his studies. But anyway, he managed to pass and went. We have no much contact with him after that one. But Rajput went back to Durban and he remained in contact with us, but he died 10 years ago. He was a general practitioner in Durban. Out of 80, we found that 14 of us married among themselves, 7 couples. 2 doctors married nurses. So that was the picture. That was good idea that we used to say that center of ossification. They used to meet especially during clinical term and during dissection. The closeness, that is very important. They came together and 14 of them have married in the same class. Have done wonderful. Dr. Parulkar, Dr. Praful Desai, Dr. B.C. Roy, S.D. Papat, and myself, we received the B.C. Roy Award. Then Padma Shri was given to Dr. Parulkar. Praful Desai received Padma Vibhushan. Many of us are the presidents of their associations, like gynecology, surgery. Sharad Bapat is the president of Urological Society of India. I was the president of Obstetrician Gynecological Society of India. Dr. Parulkar was the president of Surgeons of India. So many of us I was the vice president of Asia-Oceania Federation of Obstetrics and Gynecology. Then I was a WHO consultant as well as a consultant to Population Council. So our batch has done a wonderful thing. Out of 80, there is 36 were postgraduate. Rest were general practitioners. But maximum number of specialization. Dr. Manu Gandhi was a very famous cardiologist. Dr. Praful Desai was a superintendent of the Tata Memorial Hospital. Dr. Parulkar was the dean of the medical college and a brilliant surgeon, thoracic surgeon.
Okay, so I would like to hear the experiences about the library, as the library plays the major role in our academic tenure of the MBBS. So, sir,
Yes,
any special experience?
Sharad, you talk about the library because you have more experience about our library. Sharad.
Yes. Yeah, I think we had a wonderful library at the GS Medical College, one for the undergraduate and another for the postgraduate. And I think the access was free and there was no difficulty. But I recollect, it's an interesting incident, but I recollect wanting to get a book from the postgraduate library, but the librarian, Mr. Patange, he did not allow me to enter the postgraduate. He says, you are undergraduate. And I was not happy about this. So I immediately approached our Dean, Dr. Daigure, and he, in my presence only, he called Mr. Patange and told him that this is not acceptable. And if Dr. Bapat wants to, Mr. Bapat, of course, as I was wants to utilize the postgraduate library, he should have a free access. And just the way you are giving access to other students, he should also be having a free access to postgraduate library. So I was happy. on the whole, I think we had an excellent library. I recall many times sitting there late in the evening, sometimes at night also, utilizing these facilities available at the library.
Mr. Patange was the librarian, and I think
Yes.
at our time the library was open till 10 p.m. So many of us, after having dinner in our mess, we used to go to the library and then read there for almost till 10 o'clock when the library was closed. I do not know whether now the library is open till 10 o'clock or not. Can you tell us now, say, Sejal or Kanchan?
Yes, it's most of the time now the library is open for like 24/7. So
24
we get a
hours.
lot of time to. Yes, yes,
Oh, that's good. Very good. And our
yes.
time it was closed at 10 p.m.
Yeah, sir. So
I am pleasantly surprised that the library is open all the time, is it?
yes, even on the Saturdays, Sundays, it's open 24/7. So most of the students spend their maximum of the productive time there, reading books, studying.
But is it open whole night also, or it is all closed? When
Yes,
does it?
yes.
Oh, that's very
It
great.
Yeah, only for the cleaning purposes, it's closed in the morning at from like 7 a.m. to 8 a.m. Rest the whole time is open.
For cleaning purposes.
Yes, yes.
How many people go at night? Have you been going? Are you visiting?
Mostly in the it's more fruitful and the productive hours that we can get in the library are the most that
Sejal, your voice is breaking.
So, like in the usual hours, in the library, there are around like 15 or 20 people or so. But on the exam eves and the day before the exam, it's like half of the library would be filled, I would say, even during the night times.
You can go to the next question.
Sir, I would like to ask you about your first experience in the ward, the clinical postings that you had, like first time interacting with the patient and their relatives and all. How would you explain that? Or do you have any specific memories?
Memories of the going to the ward for the first time. Hello.
Ask for the next question.
So I
Dr.
would
Bapat, do you
be
go
okay,
ahead?
okay. I would like to ask experience in your MBBS that made a positive impact on reality that have stayed with you all over the years. Am I audible? Am I audible?
Yes, yes, yes.
Yes, I can hear.
Okay. Like any of the learning experiences that you remember and has changed has been a turning point.
I think
Like
all
all
of us
the
were greatly benefited by the experience which one of us has from the wards, from the teachers, from the bedside clinics, and many times our teachers, as I think mentioned already by Dr. Rohit Bhatt, that at our time, really the batches were small, and something unique about the experience at that time that we had a mix-up of senior and junior at the same time. So that probably in each batch we had 5 or 6 junior and 2 or 3 senior members. And this was a good coordination between, there was good coordination between the two. This system, I don't know whether it continues today.
Yeah, it does, sir. In our times also we have a good friendly relationship or coordination with our seniors, and juniors as well. Sir, as you mentioned them, do you have any specific favorite seniors or juniors in mind which you have worked well with?
Where the clinics that we used to have from our teachers. And these clinics were generally held very often at the bedside, but many times in the last portion, there was a corner in which facilities were available for a larger group to meet and to discuss clinical cases and materials, or for the teachers to address or speak to the students. And I remember Dr. Baliga many times took clinics not by the bedside, but in the special area where many of us were, we sat down, and he used to conduct the clinics in his very special style. I don't know how many of you have memories of the clinic by Dr. Baliga, but they were unique because he would discuss a particular case, and after the case was presented, the differential diagnosis, and those of us who worked with him recall his very special style of making important diagnosis, essential 3 important diagnoses above, then below the line are the rare possibilities which also are possible in that particular case. So this above the line and below the line was an interesting way of giving his idea about differential diagnosis.
Oh, that was great, sir. I wanted to ask, have you faced problems in study because of the lack of familiarity, like in the expertise, or ever has the language become a barrier, like to accommodate with English or Hindi in any of your batchmates? Do you remember?
I think at our time we had no difficulties about the language as such, because the communication between the doctor and the patient, we invariably had no language barrier as such. And the perception about
Okay.
these days, I believe these problems are definitely there, because at my time, at our time, the patients were generally from our same area. They were able to talk, and we were able to understand. There was no language problem as such. I don't recollect anything.
Sir,
Shall we
anything you
finish it now?
Yeah.
one more question, sir. Any specific thing you'd like to mention about your hostel life? Or anyone? Like the pros and the cons, or any improvements that you would have needed in your time?
No, I don't know what exactly you have in mind, but I think at our time, because the batches were small, there was no difficulty. We did not perceive any difficulty as such. But I don't know what is the situation at present with the very large number of students that are admitted each year. I am sure there must be difficulties, but I don't know about. At our time, we did not have any specific difficulties while discussing with patients or with each other.
Sir, I would like to ask that if there was any specific innovations done by your batch which you would remember, like the one that batch 1950 is known for. Anyone?
Well, I think Dr. Bhatt Rohit has already mentioned about one unique feature that we started, and he has mentioned about Dr. Jagat Prasad from Africa, who was part of our batch, and he introduced a system of welcoming the junior batch as they come instead of ragging or anything like that. So this was a very much difference was very obvious for newcomers that there was no question of ragging, but the new students were actually welcomed by the senior and the previous students. So I think this was a good interaction between different batches.
Yes, sir. Uh, like, so one more question. Like recently in our college time, there are usually a lot of hangout places, like the canteen, of course, and there's also a coffee place which we call KD. So, do you have any specific canteen memories that you could mention with your batchmates? Yes.
I think canteen was not a very large area. I think it was a small area, and I don't recall the name, but Martin or Mr. Michael was either of this name was there, and he provided food many times for functions that were organized. I remember at the RMO quarters, we used to get food provided by canteen. So canteen was a good source of getting various food facilities depending on our requirements.
At your time, did you have any specific cultural events
Sir,
that?
yeah.
Go ahead,
I
Sudha.
wanted to ask the
Go
same
ahead.
question.
Go ahead. Go ahead.
Like any of the extracurricular activities that played a major role in your uh, making the MBBS more fun.
No, I personally participated in various extracurricular activities, but that is particularly with respect to me because facilities were there, and I participated in the elocution competition, body beautiful competition. I sang, uh, presented songs in the main hall, and I remember various other students from our batch also. They presented, and one I remember very distinctly was Dr. Udvaria. M10 Udvaria, I think he had a very good command on English language, and he presented also. His way of presenting himself was very good, and he always attracted attention. But there were ample facilities for participation in extracurricular activities.
Okay, sir.
Okay.
So, what about your Gymkhana experiences? Like, were your batch members any like major members of it, or do you have any memories of it, of the Gymkhana, or any committees similar?
I personally have very good association I had with the Gymkhana because I stayed in the hostel and the Gymkhana was very close to the hostel with facilities for exercise and whatever you wanted to achieve. And at least I was an active participant of the Gymkhana as such. But not many It was not full, but I don't think it was a particularly attractive place for many students. As such, I was happy with my association with the Gymkhana. Yeah.
If all questions are done, Sejal and Saud, okay. Any
Okay,
of the
sir.
members
Yeah.
want to speak, you can give each one an opportunity to speak by themselves. And if they're done with it, then you can start with the reflections and vote of thanks. Okay.
Yes, sir.
Rohit,
Thank you.
Any of the members can speak impromptu about their perceptions during the student days. If any, failing which, we will just then end the program with in about 10 minutes time.
Dr. Rohit Bhatt, I think he has some problem with the electricity, and therefore we are not able to see him or enjoy his active participation in this meeting. Otherwise, he's always full of new information and his active participation is always very, very important from the point of view of all of us.
Glad to see you all. Thank you.
It's been a great experience. Now I think Sejal and Saud can go ahead with the reflection video.
Okay, I would like the tech team to play the reflections video by Dr. Swarupa Bhagwat.
A very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. G.S. Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. G.S. Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was literature and medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. G.S. Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us, the readers of the book. We, as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
Now, I would like to thank.
Now, can I add something? Because
Yes, sir.
Yeah, sir.
Welcome.
Yes, sir. Yes.
Yes.
I was very keen to point out and mention that I recently published a book about my memories. The title of the book is A Urology Journey. And this particular book, in this book, I have covered all the experience which I had of the GS Medical College, the KEM Hospital, and some of our associations and so on. All these were pointed out, and I thought, I do not remember any other publication from any of our batchmates about our time, and I thought that this particular book will be of immense help to bring the past to our knowledge, and I have covered as much as possible right from the beginning up to now.
It will be an asset for
Yes,
the
yes.
institution, for sure. It will be an asset for the institution, for sure. Recalling the past. The book will be an asset for the institution.
I have given a copy to the library also, but I would like to give another copy, 1 or 2 copies also, because I do want my book to be read by many, and even if a copy is available in the library, the layout of the book itself is such that it will attract attention, and many people will be inclined to read the book as such. So I would definitely be happy to have any occasion to introduce my book to the college or to the library also.
I got it and read it. It's very good. I call us now.
Yeah, and I think during centenary celebration, in any of the events when you'll be coming in, maybe at that point in time, the book can be added to the library.
One copy of the book is already in the library.
Yeah.
But I would definitely be making more copies available at any time if required. And I will utilize this occasion to make sure that 2 more copies are introduced and given to the library.
Yes, sir, it would definitely be a valuable addition to all the historical books and for the references of students as well as faculties. Does anyone else want to add anything? Okay. So should I proceed for the vote of thanks?
Yeah, please proceed, Sejal.
Yes. We would like to thank our Dean, Dr. Sangeeta Rawat Madam, and Academic Dean Dr. Pathak Sir for their continued support and encouragement. We thank the Gosumec Alumni Association for the administrative support for correspondence and financial transactions of Dr. M.V.L. Kothari Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for audio, visual, and technical support. Mr. Maitre for video recordings. Last but not the least, a big thank you to Dr. Bhatt, Dr. Bapat, Dr. Parikh, Dr. Sardesai, Dr. Hirve, and to the whole batch for their enthusiastic participation. It was a pleasure to hear all the experiences that you shared with us. Thank you.
In continuation of
Thank you
what
very much.
Sejal said, hello. In continuation of
Yes,
what
sir.
Sejal said, I would like to place on record that there are a team of 10 students, 2 of them from 2020 batch and 8 of them from Sejal's batch 2022. They've been doing a wonderful service for the last 1.5 years, right from July 2023. Every Saturday, there's been a batch which has been interviewed and presented. And 2 of the students have volunteered, taken out the time and helped out with all these activities. Just to put the names on record, from 2020 batch, it's Dr. Muskan Chabria and Dr. Arushi Rajput, the 2 main coordinators. And then from 2022 batch, you met 2 of them today, Dr. Sejal Pawar and Dr. Saud. And there are Dr. Shikhar, Dr. Anj, Dr. Gauri, Dr. Devashri. I'm forgetting 2 more names, but shortly we'll be preparing a collage of this and we're projecting also for the excellent work they have been doing. Thank you very much. It was a great pleasure. Now the video will be, the recording will be stopped.
I have
Yes.
enjoyed the participation and enjoyed talking to all my colleagues after a long time. And I want to particularly thank Dr. Natarajan for making this particular facility available and for giving an occasion for interaction between the past and the present.
Sir, it's actually a team. If I would like to interrupt, meaning it's a teamwork, and the TEAM as an acronym means together everyone achieves miracle. So the team includes all of you, all the batchmates, the team of medical humanities, Dr. Padmaja Sawant, who is the main coordinator, Dr. Lopa Mehta, who initiated this proceedings, and then initially all the details of the medical humanities team are projected. And this set of 10 students, and along with them Dr. Kanchan Kothari and Dr. Swarupa Bhagwat. This team has been working. So though I'm the face of the team, but it's a collective work. And it has been a great evening. It was a pleasure. The live recording will stop, and then after that, the link will be disconnected. Thank you very much for this wonderful evening, sir.
Thank you.
Thank you, sir. Thank you, ma'am.
Thank you, sir.